Francine, we need to speak with you.
I'm sorry, who are you?
We found out about the gift cards you've been handing out.
For nearly 2 decades, dozens of recovering addicts trusted Francine Sims Super with their treatment and their second chance at sober life. Every single one of them was wrong too, and this is the morning she finally answers for what she did.
Patience.
I have no idea what you're talking about. Those are patient incentives. That's
$1 million
standard.
in Walmart cards is not standard.
That is
You have the
absolutely
wrong-
not.
She would not be running anything ever again. Within 72 hours of the moment you just watched, federal agents had seized $6.2 million in cash and real estate, cracked open a home safe in a Houston suburb, and pulled 3 years of forged Medicaid audit responses out of her office filing cabinets, $15.3 million in fraudulent billings, $1 million in Walmart gift cards funneled to drug-addicted patients in exchange for their Medicaid numbers, and a co-conspirator who had panicked exactly 7 days earlier, withdrawn $1 million in cash and hidden it in a safe behind a closet wall in Katy, Texas. Quick question. Would you have spotted the warning signs in a place that was supposed to be saving lives? Tell me in the comments. If you're new here, hit subscribe. We hold people in positions of trust accountable every single week. Francine Sims Super was born in October 1961 in Snow Hill, North Carolina, a tobacco town of less than 1,500 people, about 30 minutes north of Kinston. Her father, Wendell Sims, worked the curing barns at a Greene County tobacco cooperative. Her mother, Velma, kept the books for a small farm supply store on Highway 58. Francine grew up in a 2-bedroom clapboard house with peeling cream paint, a window unit in the kitchen, and a back porch that looked out over a soybean field. She was the second of 4 children, the first to finish high school, the first to leave Greene County. By the time she walked out of Greene Central High School in 1979, she had already been working part-time at a doctor's office in Snow Hill, filing insurance claims by hand. The office manager called her the most organized 17-year-old she had ever met. That phrase would follow her for the next 4 decades. Detail-oriented, reliable, the one who knew where every piece of paper lived. She enrolled at Lenoir Community College in Kinston in the fall of 1979 and earned a 2-year certificate in medical office administration. She paid for it herself, working evenings at a cafeteria on the college's main campus. Her first full-time job after that was as a billing clerk at a family medicine practice in LaGrange, North Carolina. Starting wage, $4.25 an hour. She stayed there 11 years. In 1992, she married Curtis Super, a long-haul trucker out of Wilson County. They had 2 children together, Brandon, born in 1993, and a daughter, Tabitha, born in 1996. The family moved into a brick ranch in Kinston in 1998, on a quiet street lined with crepe myrtles, and Francine took a position as billing supervisor at a small mental health clinic on Vernon Avenue. Her supervisor at the clinic wrote in a 1999 evaluation that Francine anticipated compliance issues before they surfaced and demonstrated an exceptional grasp of state Medicaid procedures for someone without a 4-year degree. She was promoted to office manager in 2001. By 2004, she had passed the Certified Professional Coder examination on her first attempt. She kept the framed certificate above her desk for the next 20 years. Friends from that period describe a woman who brought casseroles to co-workers' funerals, sat in the front row of every school choir concert, and ran the front office of a small clinic with a precision that made auditors comfortable and bosses unworried. She was, by every account, the woman you trusted with the paperwork no one else wanted to touch. In 2007, when a man named Reginald Whitlow opened a small substance abuse counseling practice in Kinston called Life Touch LLC, he asked around about who could run his back office. 3 different people gave him the same name, Francine Super. He hired her on a Tuesday. She started the following Monday. Her starting salary was $46,000. By 2018, she would be making $138,000. By 2022, the year the federal investigation opened, she would be the highest paid employee at Life Touch, higher than the licensed clinical staff, higher than the medical director, higher than the man who owned the company. That trust was about to be tested in ways nobody who knew her in Snow Hill could have imagined. Life Touch LLC was licensed by the North Carolina Department of Health and Human Services in 2007 as an outpatient substance abuse treatment facility. Its single storefront sat in a strip mall on West Vernon Avenue, between a tax preparer and a discount tire shop. The waiting room had 8 folding chairs and a coffee maker that nobody refilled. The treatment rooms in the back smelled like industrial carpet cleaner. The facility billed almost exclusively to North Carolina Medicaid. Its patient population came from the poorest counties in the eastern part of the state: Lenoir, Greene, Wayne, Pitt, Duplin. Most of them were addicted to opioids, methamphetamine, or both. Many had open warrants. Many had children in foster care. Many were one bad week from sleeping in a car. For each of these patients, North Carolina Medicaid paid Life Touch between $85 and $430 per session, depending on the service code billed. Group therapy paid less. Individual counseling paid more. Comprehensive clinical assessments, the diagnostic intakes that opened a new patient file, paid the most. A single well-coded intake could generate $430 in reimbursement for less than 90 minutes of work. In theory, the system had safeguards. Patients had to sign in. Counselors had to document the session. Progress notes had to be tied to a treatment plan. Random audits could be triggered if a single facility's billing volume spiked beyond regional norms. The North Carolina Department of Health and Human Services Office of the Inspector General employed a small team of investigators tasked specifically with substance abuse treatment fraud. In practice, the safeguards depended on one thing: documentation. Whatever Francine Super signed off on as the office manager, the state of North Carolina paid. Whatever she filed in response to an audit request, the auditors believed. She had been doing the paperwork without complaint for 11 years before anyone in Raleigh thought to question it. There was one other detail. North Carolina, like most states, allowed substance abuse facilities to provide small patient incentives to encourage attendance. Coffee, snacks, occasional gas cards under a strict dollar amount, distributed transparently and documented in the patient file. The rule was meant to address the brutal economics of recovery, where missing a session sometimes meant missing a paycheck. The threshold was modest: $20 per patient per visit, $50 maximum per month, tracked, signed for, audited. Francine Super understood that rule better than anyone in the building. She had also figured out that nobody outside the building knew it existed. The first gift card was handed out on a Thursday in March of 2017. A man named Deshaun, 26 years old, 4 months out of Pamlico Correctional and recently relapsing on heroin, walked into Life Touch looking for a methadone referral. He was told he had to be assessed first. The intake counselor wrote up a comprehensive clinical assessment. Francine billed Medicaid $430. She walked Deshaun out to his car, personally, and pressed a $50 Walmart gift card into his hand. She told him there was another $50 waiting if he came back the following Tuesday. Deshaun came back the following Tuesday. Then the Tuesday after that. Then twice a week for the next 11 months. Each visit generated a session note he never read. Each session note generated a Medicaid claim. Each claim generated a check. By the end of 2017, Life Touch had billed Medicaid more than $700,000 on Deshaun alone. The pattern, once established, did not require Francine's improvisation. It required only her management. She kept a notebook, a real one. Green canvas cover, spiral bound, the kind sold at the Lenoir Community College bookstore. In it she logged the patient initials, the gift card amounts, the dates of distribution, and the session codes billed against each patient's name. She kept the notebook in a locked drawer in her office. She kept the gift cards in a separate locked drawer. The keys lived on a lanyard around her neck. Over the next 5 years, the operation expanded. She trained 2 front desk staff to hand cards out under her supervision. She found a wholesale distributor that sold Walmart and Target gift cards in $5,000 lots at a small discount. She negotiated with a methadone clinic in Greenville to refer patients who were compliance ready. She began coaching certain high-volume patients on what to say during the rare audit phone interview. Repeat the session times. Mention the counselor by name. Do not mention any cards. The patients were not stupid. Most of them understood exactly what they were being paid for. A handful tried to refuse. They were quietly removed from the active roster. The ones who stayed got cards every visit, sometimes 2 visits a day, sometimes phantom visits where they signed a logbook and walked back out without seeing anyone. The escalation was steady. In 2017, Life Touch billed Medicaid $2.1 million. In 2018, 3.8. In 2019, 4.4. In 2020, even with the pandemic, 4.1, because Francine had quietly transitioned a third of the billing to telehealth codes and was now paying patients to answer a phone for 15 minutes. By 2022, the facility was billing Medicaid at a rate that exceeded the next 3 competing facilities in eastern North Carolina combined. Reginald Whitlow, the owner, was paid a salary of $300,000 a year and asked very few questions. The clinical staff were paid above market and discouraged from looking at billing codes. Francine's son Brandon, a 26-year-old with no medical background, was put on payroll in 2019 as a compliance consultant at $110,000 a year. Brandon had moved to Katy, Texas, with his fiancée by then. He performed no compliance work. He cashed the checks. The signs were everywhere. A 2-room storefront billing more than a regional hospital outpatient program. An office manager driving a 2021 Cadillac Escalade. A Brunswick County beach condo purchased in cash in 2020. A second home in Katy, Texas, in Brandon's name, with a basement gun safe and a backyard pool. No one noticed. No one checked. Until somebody did. Stories like this don't get the coverage they deserve, and the people they hurt are the people most of us walk past without seeing. Subscribe and hit the notification bell if you want to see more accountability work. Comment below if you've ever known someone whose recovery was treated as a transaction. The catalyst was a routine statistical review. In April of 2022, an analyst at the North Carolina Department of Health and Human Services Program Integrity Unit named Pamela Hutchins ran a quarterly comparison of substance abuse facility billing volumes against patient census numbers. Life Touch LLC sat at the top of her spreadsheet. Its billings were 41 standard deviations above the regional mean. Its patient retention rates were nearly perfect. Its no-show rate was effectively 0. Hutchins flagged the file. She wrote a single sentence in the case management system. Numbers do not appear physically possible for a 2-counselor outpatient operation. The flag was forwarded to the Federal Health and Human Services Office of the Inspector General because the dollar amounts had crossed the federal threshold. Special Agent Marcus Yelvington, a former North Carolina state trooper turned federal investigator, was assigned the case in May of 2022. He requested patient billing records under a routine administrative subpoena. Francine produced them within 48 hours, organized in 3-ring binders, color-coded by service line. Yelvington took the binders home that weekend. He spread them across his kitchen table. He ran the patient names against state criminal records, against employment data, against death records. By Sunday night, he had found 17 Life Touch patients who had been incarcerated at a North Carolina state prison on dates the facility had billed for in-person sessions. He had found 4 patients who were dead. He had found 1 patient who was billed for 32 sessions in a single calendar month, a logistical impossibility for an outpatient program operating on a 5-day schedule. He did not call Francine. He did not call Life Touch. He drove to Raleigh on Monday morning and met with the United States Attorney's Office for the Eastern District of North Carolina. By Wednesday, the case had been opened as a federal healthcare fraud investigation. By the end of June, Yelvington had a federal grand jury reviewing financial records, surveillance authorization on the strip mall storefront, and pen registers on 3 phones. Francine's, her son Brandon's, and a burner number that had been calling and texting both of them. For 7 months, Francine knew nothing. She drove to work. She ran the front office. She handed out gift cards. She filed audit responses to the very state agency that was now sharing its records with the federal grand jury investigating her. Then somebody talked. A former Life Touch patient named Kaylee, 29 years old, 6 months sober, and trying to regain custody of her 2 children, walked into the federal building in Raleigh in October of 2022 and asked to speak to whoever was investigating her old treatment program. She had been called to testify in a custody hearing about her recovery. A judge had asked her to describe her treatment. She had told the truth. She told it again to Special Agent Yelvington. He took 11 hours of recorded testimony over 2 days. She named names. She described the notebook. She described the lanyard around Francine's neck. Yelvington moved fast. On October 19, 2022, federal agents executed simultaneous search warrants at 3 locations: the Life Touch office on Vernon Avenue, Francine's brick ranch in Kinston, and, at the request of HHS OIG, a 4-bedroom house at 4218 Honeysuckle Drive in Katy, Texas, registered to Brandon Sims and his fiancée, Mia. What they found at the Life Touch office filled 47 evidence bags: the green spiral notebook, 3 years of audit response files with dates that did not match the original Medicaid logs, a locked cabinet containing $83,000 in unsold gift cards, a handwritten list of 17 patients with red checkmarks beside their names, the patients who had been coached before audit interviews. What they found at the Kinston house added another 19 evidence bags: a safe in the master bedroom closet containing $142,000 in cash, bank statements for accounts in the names of Francine, Curtis, Brandon, and Tabitha, showing combined deposits of more than $4 million over 5 years, title paperwork on the Brunswick County Beach condo paid for in 3 certified checks, a 2021 Cadillac Escalade in the driveway paid in cash. What they found in Katy, Texas, was the centerpiece of the case. Behind a false closet wall in the basement of the Honeysuckle Drive house, agents discovered a Liberty brand floor safe bolted to the foundation. Inside, neatly banded in stacks of $100 bills, sat $997,000 in cash. The bands carried tape strips dated September of 2022, exactly 7 days after Brandon Sims had received a 2-minute phone call from his mother that pen register data had captured but not recorded. A separate text exchange recovered from Brandon's phone, dated September 14, 2022, read as follows: Francine, we may have a problem. Pull what you need to pull. Brandon, how much? Francine, all of it. The Greenville account too. Don't leave a paper trail. Brandon, where do I keep it? Francine, somewhere they would never look, and not the bank. Brandon, got it. The smoking gun was not the cash. The smoking gun was the timing. The grand jury indictment, returned February 8, 2023, listed 71 federal counts against Francine Sims Super and 43 counts against Brandon Sims: healthcare fraud, conspiracy to commit healthcare fraud, money laundering, aggravated identity theft for the falsified patient signatures on audit responses, obstruction of a federal investigation, tax evasion against the IRS for $373,000 in unreported income. Reginald Whitlow, the owner of Life Touch, signed a cooperation agreement before the indictment was unsealed. He testified that he had asked Francine twice about the billing volumes and had been told both times that the facility was running a tight ship and that he should focus on growth. He pleaded to a single felony count and received probation. The arrest happened on the morning of February 9, 2023, at 9:47 a.m. in Francine's office at the Life Touch storefront. She had been at her desk for less than an hour. She was wearing a navy cardigan, reading glasses on a beaded chain around her neck, and was reviewing a Medicaid claims summary when Special Agent Yelvington and 2 HHS OIG investigators walked through her open office door. She looked up, surprised. Yelvington spoke first. Francine, we need to speak with you. She turned in her chair. Her hands moved instinctively toward the locked drawer. I'm sorry. What? Who are you? We found out about the gift cards you've been handing out to patients. She shook her head. The motion was firm, practiced. I have no idea what you're talking about. Those are patient incentives. That's standard. $1 million in Walmart cards is not standard. Her voice rose. The reading glasses chain swung against her sweater. That is absolutely not. You have the wrong woman. I run a clean program. Yelvington watched her face for the next 3 seconds. He had been told by Kaylee what to look for: the slight tightening at the jaw, the hand drifting toward the lanyard at her neck. He did not raise his voice. He laid a single document on her desk, a printed copy of the September 14th text exchange between her and her son. He turned it so she could read it right side up. She read it. Her eyes moved from the first line to the last. She did not blink. "Francine," he said, "Brandon was arrested in Katy at 6 o'clock this morning. The safe is open. We have everything in it. I need you to stand up, turn around, and place your hands behind your back." She stood. She did not say another word until her attorney arrived 9 hours later. The case did not go to trial. After 11 months of pretrial motions, after her attorney, a Raleigh white-collar specialist named Holland Geddes, filed and lost 3 suppression motions on the search warrants and 2 challenges to the grand jury's reliance on Kaylee's testimony, Francine Sims Super signed a plea agreement on January 22, 2026. She pleaded guilty to 7 consolidated counts: healthcare fraud, money laundering conspiracy, aggravated identity theft, and tax evasion. Brandon Sims pleaded the same week. He received 46 months and agreed to forfeit the contents of the safe and the Honeysuckle Drive house. Sentencing was held on March 11, 2026, in the United States District Court for the Eastern District of North Carolina in Greenville. The presiding judge was the Honorable Letitia Voss, a former federal prosecutor who had spent 4 years on the bench and whose courtroom was known for its silence. The government called 3 victim witnesses. The third was Kaylee. She had been sober for 41 months by then. She had her children back. She read from a single sheet of paper that she held with both hands. "You knew what we were when we walked in there," she said. She did not look at Francine. She looked at the judge. "You knew exactly what $50 meant to a person who had not eaten in 2 days. You knew what the cards would buy. You knew, every time we signed a logbook, what we were going to do that night. You knew, and you sent us out the door with another card and another appointment, because every appointment was money in your pocket. You did not see us as people. You saw us as line items on a spreadsheet. I was a line item. My children were collateral." She set the page down. She walked back to her seat. Judge Voss spoke for 9 minutes before announcing the sentence. The relevant portion lasted 30 seconds. "Ms. Super, the defendants who come before this court for healthcare fraud are usually motivated by greed. You were motivated by something more troubling. You found a population of people whose addiction made them incapable of refusing what you offered, and you weaponized their disease against them and against the program designed to help them. You did this for 15 years. You did it well enough that no one caught you. You hired your son into the scheme and taught him how to hide cash. And when you sensed the investigation closing, your first instinct was not to stop. It was to move the money to a basement in Texas. The court does not believe you have ever felt remorse. The court believes you have only ever felt caught. The sentence: 72 months in federal prison, 3 years of supervised release, restitution of $15,300,000 to North Carolina Medicaid, restitution of $373,000 to the Internal Revenue Service, forfeiture of the Brunswick County condo, the Katy house, the Cadillac, the cash, and Francine's primary residence in Kinston. She is currently incarcerated at the federal prison camp at Alderson, West Virginia. Her projected release date is January 2031. She will be 69 years old. Life Touch LLC was permanently barred from billing North Carolina Medicaid. The storefront on Vernon Avenue is now a payday loan office. The waiting room chairs were sold at auction. Reginald Whitlow served 18 months on probation and now sells insurance in South Carolina. Of the 341 Life Touch patients identified in the indictment, 68 died of overdose between 2017 and the date of sentencing. The federal complaint does not allege Francine's scheme caused those deaths. It does note, in a footnote on page 81, that none of those patients received any treatment beyond a signature, a session note, and a $50 gift card. This case was sickening, but the one on your screen right now is even harder to sit through. Click it before you scroll away.